She was the floater, the agency nurse they rotated between floors without bothering to learn her name, until the night a dying woman pressed a folded piece of hotel notepaper into her hand, whispered a 7-digit number, and every exit in Maplewood Regional Medical Center sealed shut. By the time the federal marshals cleared the building, the people who had spent their shift calling her, "Hey you," could not look her in the eye. Senna Walsh had been at Maplewood Regional for 3 weeks. She would be there for 3 more, and then she would go somewhere else. Another mid-size hospital in another city, another contract, another set of faces that would forget her the moment she clocked out. That was the arrangement she had made with herself, and she had kept to it with the same discipline that governed most of her decisions. She was 32 years old. She had been a travel nurse for 2 years. Before that, she had been a Navy corpsman attached to a Marine Raider battalion for 6 years, 3 of them in places that did not appear on any public record of U.S. military operations. She had made decisions under conditions that would have paralyzed most emergency physicians, with resources that would have made most emergency departments weep in the dark and the dust. And the particular silence of a situation already past the point where any choice was clean. She did not talk about that. She just did the work. Maplewood Regional was a mid-size hospital in Raleigh, North Carolina, the kind of institution that described itself as a regional center of excellence and meant it only in the loosest possible sense. The lobby was polished. The staffing was thin. The permanent nursing staff had a social architecture, as rigid and specific as any field unit Senna had served in, with the key difference that in a field unit, the hierarchy existed because someone had earned it. Dr. Elliot Grantham was the cardiac surgery attending on overnight call. He wore a Rolex with his scrubs and addressed nurses by their role rather than their name, not out of cruelty, but out of a lifetime of never needing to do otherwise. He had been wrong about 3 patients this month in ways Senna had silently noted and silently set aside. He was the kind of doctor who mistook confidence for competence and had been surrounded by people who could not tell the difference for long enough that neither could he. Lorraine ran the med-surg floor. 11 years, the same unit, the same desk, the same tight ownership of everything within her sight. She was not malicious. She was territorial in the particular way of people who have confused a place with a purpose. And agency nurses, temporary, overpaid, unearned, were a category of intrusion she had never learned to tolerate. At 11:30 on a Tuesday night, Senna was restocking the supply cart when she noticed the telemetry reading above bed 7. The patient was a 58-year-old man post-op day 2 from a knee replacement. Straightforward recovery, no cardiac history, no reason for the rhythm she was seeing. She looked at it for 4 seconds. Then she walked to the nurse's station. "Dr. Grantham," she kept her voice even. "Bed 7's rhythm looks like early fat emboli." He did not look up from his dictation. "It's a post-op blip. His sats are fine. His oxygen saturation is trending down over the last 20 minutes. The rhythm pattern is. I have his chart." He did look up then, briefly, the way a man looks at something he has already decided is not worth his time. "Thank you, Walsh." She went back to the supply cart. 22 minutes later, the alarm from bed 7 filled the hallway. Fat embolus to the lung. Grantham swept in, ordered the exact intervention Senna had suggested, and stabilized the patient with the brisk competence of a man who had caught a problem early. The night staff praised his attentiveness. He accepted this without correcting it. Senna watched from the doorway and said nothing. She had learned this particular silence in places where silence was a survival skill, not a concession. She was charting at one of the station computers at 3:40 in the morning when EMS rolled through the ambulance bay with a gurney. One paramedic, a young man named Ashby, called out to Lorraine at the desk. Female Jane Doe, mid-40s, found unresponsive in room 412 of the Meridian Hotel 2 blocks over. Hotel staff called 911 when she missed checkout and didn't answer the door. Possible GHB or benzo OD. No ID, no purse, no phone. Room paid in cash 3 nights. Lorraine assigned Senna without looking up from her clipboard. Bed 14. Monitor vitals and wait for tox. Senna pulled the curtain around bed 14 and put on her gloves. The paramedic's assessment held at first glance. The woman was in her mid-40s, dressed in gray slacks and a silk blouse, business clothes, good quality, the kind of outfit someone packs for a work trip rather than a vacation. She was deeply unconscious, breathing on her own, color not terrible. Classic presentation for a sedative OD. Senna started at the feet. The woman still had her shoes on, low black heels, real leather, expensive. The inside edge of each sole was worn in a specific pattern, the asymmetrical wear of someone who stood for long periods with their weight shifted slightly forward. A courtroom stance, a presentation stance, not a tourist. Senna moved up. The woman's hands were manicured, but not pampered. Short nails, a faint ink stain on the side of her right index finger that the hospital wipes had caught, but not fully removed. The hands of someone who wrote constantly. She pushed back the left sleeve to place the IV and stopped. On the inner forearm, 2 inches below the antecubital crease. A small, precise contusion. Subcutaneous, not a track mark, not a vein puncture, a targeted injection, administered by someone who knew what they were doing and where to do it. Maybe 4 hours old. Senna checked the pupils, unequal, right slightly larger than left. GHB and benzos did not cause asymmetric pupils. She connected the cardiac monitor. Heart rate 52. Irregular in a way that brought her hand to the bed rail without thinking. Premature ventricular contractions. Clustering in groups of 3, then settling, then clustering again. A specific pattern. She had seen it once before, in the back of a MRAP in Helmand Province. When a man their unit relied on had been slipped something into his tea by someone who was supposed to be an ally. He had survived because someone had recognized the pattern and known what it meant. Senna stood still for a moment. Then she walked to the nurse's station. Dr. Grantham. She stood at the edge of his field of vision. Bed 14. I need you to look at her. Lorraine said it's a probable OD. Tox is pending. Her pupils are asymmetric. She's running grouped PVCs in a pattern that doesn't fit any sedative OD I know of. She has a subcutaneous injection mark on her left forearm. He looked up then. The particular look of a man who has recently been proven wrong and is not yet ready to learn from it. How long have you been on contract here? 3 weeks. He set down his dictation recorder. Walsh asymmetric pupils can be positional artifact. Grouped PVCs can reflect hypoxic irritability. A sub-Q mark could be anything. I have been a cardiac attending for 14 years, and I have seen the full range of OD presentations, including the unusual ones. Your job tonight is to monitor that patient and document her vitals until tox comes back. If I'm wrong, tox will confirm it. If I'm right. You're not right. He picked up the recorder. Bed 14. She walked back to bed 14. She was checking the IV line 40 minutes later when the monitor changed. The PVCs accelerated, the clustering tightened, and then, without the gradual deterioration that preceded most cardiac events, the woman's hand shot out and closed around Senna's wrist. Her grip was wrong for someone this ill, deliberate, trained. Her eyes opened. They were bloodshot and barely focused, but there was a precise, urgent intelligence behind them. "Listen," the woman said. Her voice was a ragged thread. "A modified aconitine. You need flecainide and magnesium, not amiodarone. Flecainide, 100 milligrams IV push." Senna looked at her steadily. "How do you know that?" "Because I know what they used." Her free hand moved to the neckline of her blouse, reached inward, and retrieved a small piece of notepaper, folded into quarters. She pressed it into Senna's palm. "Call that number. Tell them Falcon is down. Say the hotel room is compromised." Exactly those words. Her grip released, her eyes closed. On the monitor, the PVCs escalated into a run of ventricular tachycardia. 6 beats, 7, 8, sustaining. Senna moved to the crash cart. She had the syringe drawn when Grantham appeared in the doorway. He crossed the room in 5 steps, took in the monitor, and reached for her wrist. "Do not push that. It's toxin-induced VTAC from a modified aconitine compound." She did not move away from the IV port. "Amiodarone will worsen this rhythm. Flecainide will convert it. I need 60 seconds. You are an agency nurse, and you do not make this call. Then make it yourself." She looked at him directly. "Order the flecainide, and I will defer to you completely, or get out of the way." He reached for her arm. She had not raised her voice. She had not threatened him. She had been trained by people who considered raised voices and threats to be a failure of method because the correct application of physics achieved better outcomes than the incorrect application of emotion. She removed his hand from her arm with a minimal, specific movement that she had practiced several hundred times in a facility that did not officially exist. And Grantham stumbled back against the supply cart less from force than from the complete shock of encountering a refusal that had no anger in it. He stared at her. The monitor screamed. "Call a code or step back," Senna said. She pushed the flecainide. Lorraine was in the doorway. 2 other nurses stood behind her. Nobody moved. Senna followed with magnesium sulfate. 2 grams, counting in her head at the measured pace she had used in helicopter transport when there was no IV pump, and the calculation had to be exactly right, or the patient did not survive the flight. She watched the monitor. 15 seconds. 25. The rhythm broke, stepped down from sustained VTAC into rapid but organized beats. Then slower, the monitor alarm cycling down from emergency to caution to silence as the woman's heart found its way back to something manageable. 78 beats per minute, stable. The woman took one slow, complete breath. The color at her lips shifted from gray to something closer to human. No one in the doorway spoke. Senna set down the empty syringe and took the folded notepaper from her pocket. She looked at Grantham, who was standing with his palm flat against the supply cart, staring at the monitor. "I'm going to make a phone call," she said. "Do not move this patient." She called from the break room, standing at the window with the rain tracking down the glass in the dark outside. It rang once. "Identify," said a voice that was alert in the specific way of someone who had never expected this line to go quiet. "Falcon is down," Senna said. "The hotel room is compromised. I'm a nurse at Maplewood Regional Medical Center in Raleigh, North Carolina. She's stable. Cardiac event secondary to modified aconitine poisoning, flecainide and magnesium administered. Rhythm converted. She needs a secure ICU placement. 4 seconds of silence. Your name, the voice said. Senna Walsh. Mrs. Walsh, secure yourself in the building. No patient movement. Do not discuss this call. We are 11 minutes out. The line went dead. She walked back to the floor, checked the woman's vitals. Stable, IV running, and picked up the phone to the security desk. This is Walsh in MedSurg. I need the main entrance and the ambulance bay secured. No entry or exit without staff ID verification. The security officer sounded confused. Ma'am, that's not a standard. I know. Do it anyway. You'll have federal authorization in about 10 minutes. She hung up before Lorraine could say anything and went back to her charts. Lorraine said something anyway. Grantham appeared behind her and said something more. Senna documented the medication administration with the thorough, methodical accuracy she applied to everything. And then the front doors opened. They opened quietly. 6 people, dark windbreakers, 2 in tactical vests, moving with the choreography of a team that had rehearsed this entry. They spoke briefly to the lobby security guard who stepped back immediately. 3 U.S. Marshals, 2 FBI special agents, and a woman who identified herself only as being from a federal agency. In the singular, the woman with close-cut silver-streaked hair and a bearing that Senna recognized from the better kind of field commanders, walked directly past the nurse's station, past Lorraine's open mouth, past Grantham's half-raised tablet, and stopped at the doorway of bed 14. She looked at the monitor. She looked at the IV lines. She looked at the rhythm. Then she turned around and found Senna. Walsh? Yes. The woman crossed the floor. Deputy Marshal Ingrid Faber, protection detail. She kept her voice low. The woman in that bed is a federal prosecutor. She's been in protective custody for 6 weeks in connection with a RICO proceeding. She went off our radar 4 hours ago when the safe house protocol was breached. A pause. You kept her alive. The aconitine derivative she named. It's a specialized formulation, Senna said. Whoever sourced and prepared it had a specific background. It wasn't improvised. We know. We've been tracking the synthesis profile. Faber looked around the floor. Your security order was correct. Who authorized it? Senna said nothing. Faber's expression shifted by a few degrees. Right. It was Senna who put together the piece that had been bothering her since Ashby's intake report. She went over it while Faber's team began establishing the room perimeter, while Grantham stood in the hallway doorway looking like a man whose map of the world had just been reprinted without him. Ashby had mentioned, almost incidentally, that a man had been at the Meridian Hotel when EMS arrived. He said he was the patient's husband. He said he would follow them to the hospital. Senna walked to the Marshals stationed by the elevator. Faber mentioned the safe house protocol was breached. Was anyone aware she was at the Meridian? One person was, the Marshal said, someone who should not have been. The EMS report mentioned a man at the hotel claiming to be her husband. Did anyone flag a walk-in tonight, claiming next of kin for the bed 14 patient? The Marshal was on his radio before she finished. The answer came in under 4 minutes. A man had arrived at the ER entrance approximately 40 minutes ago. He had given a name and described himself as the husband of a woman found at the Meridian Hotel. He had been directed to the family waiting room on the ground floor. He had been there ever since. No one had checked on him. Faber moved down the corridor without breaking stride. Senna followed. The family room was past radiology. a small beige-walled space with fabric chairs and a wall-mounted television showing muted news. A man sat in the far corner, mid-40s, fit, unremarkable clothing. He looked up when the door opened. He looked at Faber's hands. Not her face, her hands. Civilians looked at faces. The man in the chair had been trained to evaluate threats differently. He stood. "Is my wife." "Keep your hands where I can see them," Faber said. He moved, not toward Faber, but toward the secondary exit in the room's back corner. It was a recessed door, half concealed by a potted plant, the kind of feature most people in a family waiting room never noticed. Senna was already standing in front of it. She had checked the exits when she walked in. She always checked the exits. It was not something she thought about anymore. It was simply something she did, the way she breathed. The man stopped when he found her there. Not because she was threatening, because she was completely still, in the particular way of someone who had held doors under circumstances that made this one look manageable. And he understood what that stillness meant. The two marshals behind Faber had him restrained and out of the room in under 30 seconds. Senna stepped back and leaned against the wall. She was breathing a little faster than usual. Not much. Faber looked at her from across the room. "You knew about the secondary exit." "I always check exits," Senna said. They brought the man through the corridor in restraints, and Grantham watched from the hallway entrance with his tablet under his arm. The incident report still open on the screen, not filed. Lorraine stood beside him, with her clipboard held to her chest. The federal prosecutor was transferred to a secure ICU room under full marshal escort. Her prognosis was good. The flecainide had converted the rhythm before the aconitine could reach the level of damage that would have made the outcome less clean. Faber stopped at the nurse's station on her way out. "We'll need a formal statement." "I'm here until 7, Senna said. "Your clinical read tonight was correct at every point." Faber said it without decoration. The medication, the call, the security measure, the exit. Every single call was right. I had context most people in this building don't have. What kind of context? I was a corpsman. Faber studied her for a moment, the way field-experienced people studied things they recognized, but had not expected to find here. She reached into her jacket and produced a card, a name and a number, nothing else. She set it on the desk. "If the travel circuit gets old," she said. She left. Senna looked at the card. She did not pick it up immediately. She sat at the station and finished her documentation. The flecainide administration, the magnesium, the rhythm conversion, the patient's brief moments of consciousness, and the clinical information she had provided. She wrote it accurately and completely, because accurate and complete documentation was one of the things she could control, and she had always controlled the things she could. Grantham appeared beside her when she was nearly done. He stood there for a moment without speaking, which was unlike him. "The aconitine," he said finally, "a modified variant. You've seen the presentation before." "Once." "Where?" She saved the note. "Somewhere that's not on my resume." He absorbed this. She could feel him working through it. The slow, private recalibration of a man who had arranged the world around his own expertise. Finding out the world was larger than his arrangement. "The incident report," he said. "File it accurately if you need to. The clinical rationale is documented. The outcome is documented." She picked up the next chart. "The decision to administer without a physician order was outside my scope of practice. That's true. But you may want to read the cardiac strip from the 30 seconds before I pushed the flecainide before you decide how to characterize the alternative. Grantham stood there for another moment. Then he took his tablet and walked back to his office, and when the day shift came in and reviewed the overnight records, the incident report was not among them. Lorraine was in the break room at 5:15. She looked up when Senna came in for coffee, and the expression she had worn every time she addressed Senna for 3 weeks, the casual practiced authority of someone who had already decided what kind of person they were dealing with, was not there. Something less certain occupied its place. "You should have told someone," she said, "about your background." Senna poured her coffee and considered this. Would it have changed anything? Lorraine did not answer. The silence between them was its own complete statement, and neither of them needed to translate it. Senna took her coffee back to the floor. Dawn came thin and pale through the east windows at 6:45. The day shift filed in, exchanging cups and complaints and the ordinary small commerce of a shift change. Senna finished her last chart note, collected her bag from the locker room, and stood at the exit for a moment before pushing through. She had 3 weeks left on her contract. Then another city, another hospital, another set of people who would learn to call her by role rather than name. She had built this life deliberately after years of deciding that the quieter version of herself was the one she could sustain. She was not entirely certain that was still true. She was not ready to do anything about it yet. The card was in her jacket pocket. She did not take it out. She stepped through the doors into the February morning, cold and damp and just barely light, and walked to her car. She drove back to the rented room she had been calling home for 3 weeks. She slept for 6 hours, straight through and dreamless. And when she woke, the card was still in her jacket, and she still had not decided, and that was all right for now.